OHDSI is an open science community. We're trying to take advantage of observational healthcare data to generate evidence that can improve the lives of patients around the world.
It's an organization comprised of people from academia, industry, government, and we're all coming together to live our mission to collaboratively generate evidence that promotes better health decisions and better care.
What is truly our mission is to improve health and to build a community. And I think that has pulled people in because they trust the initiative.
It's a very open, very inclusive community, and people are just really nice. When I got involved, I was a very early stage researcher just starting on my postdoc, but people were very supportive, very open-minded.
People feel they belong here. There's a common interest, there's a common knowledge, there's give and take. It's very supportive.
OHDSI is not a top-down organization, and because of that, it enables junior researchers to really take the lead and ownership in the studies that we're producing.
One of the best things about OHDSI is that students get exposure to experts who are leading the field of science, data, medicine, open source development, methodological work. There are so many people that you'll meet who are just fantastic at the work that they're doing. But also remember that they are so willing to help you also succeed and to help you move on in your career journey and achieve the goals that you have.
The OMOP CDM is the foundation of what we do here in OHDSI. It is our standardized data model that has allowed so much innovation in the areas of clinical research, open source development. Pretty much anything we do here in OHDSI is based on our OMOP Common Data Model.
The OMOP Common Data Model provides us a platform for standardizing the structure and the content of the healthcare data such that we can standardize analytics. But that only happens if everybody in the world can agree to that standard and apply it in a consistent way. That's why it's really exciting to see the OMOP Common Data Model adopted so widely, with collectively over 974 million patient records across over 500 databases in 50 countries, really representing the world's largest effort to standardize healthcare data and to make global data at scale available so that we can generate reliable evidence.
Being able to do research, in over 80-some countries, right around 4,200 of those collaborators that are in there.
Having more of the world help answer questions is very important because you just need numbers. In order to do meaningful statistics, you need good numbers. You want the different geographic areas, because if it turns out that you find an effect in one geographic area and you find a different effect in another geographic area, that can have two reasons. One reason is people are really different. That actually doesn't happen very often. That's very rare, very, very rare. What it does point to is that the healthcare system is different and how the interventions are done, and are they done? And then you can compare.
Open source software development is critical to the success of OHDSI. People come to OHDSI because there's a common data model. What they don't realize is how much of the knowledge and memory we put into how to analyze that data we share. And so that it's actually the analytics around that data model that really creates insights and value.
Part of open science is not just about open source your code or publish your study protocol, which are important. But I think at the end is that we have an open community that people are feeling comfortable and willing to share their ideas and help others grow their ideas.
If I program a study and I program it in a black box and nobody else can see it, who knows how many errors I have in there, or if I just did something wrong. If I make it open, it then has the opportunity for me to get feedback from other people, and I think that's very valuable.
The application of open science principles in the OHDSI community is, personally one of the things that really attracted me to this community. I really believe that we need to follow best practices and we need to follow them in a way that everybody can understand them, see them and touch them. And the sharing of open code and open practices, open science principles is the way forward.
We have regulators who listen to us, and that is only possible because we have data standards, we have analytic standards, and we have a very strong community of people who care about what they do and are really world experts in the field.
Darwin EU is an initiative funded by the European Medicines Agency to generate large-scale evidence for them to make decisions. This kind of paradigm shift of going from commissioning studies one by one to having this system where they can commission studies in parallel as they are happening as we speak and making them happen very quickly has been heavily facilitated by OHDSI, by the OMOP Common Data Model. We are indeed generating evidence at a pace and at a scale that has never been seen before in Europe.
It shouldn't be standard to run a study for more than a year to get an answer. We need to do much better than that. And I think we can do it by preparing our data up front, by standardizing it, make it more interoperable, and allowing us to use common analytics at scale.
The idea and legend that we've proposed is that we want to basically have research, instead of each one writing their own paper, come together to build sort of the machinery that generates the evidence. And then once the evidence is generated following best practices, then we can disseminate it as a whole, making sure that we avoid p-hacking and publication bias, but also that it's of a consistent quality, high quality that regulators and doctors and guideline writers can use.
We realized very early on when we looked at the OHDSI network was that there were several areas of the world that really weren't represented. And we felt like this was a real disadvantage overall to medical knowledge because obviously we're not incorporating those people from typically low and middle income countries or under-resourced, that we're not really getting a full picture of the disease or the care process that are going. And oftentimes many of the people who are bearing the greatest burden of disease within the world itself weren't even being represented in the research that was being presented.
We as a community over the past 10 years have been able to standardize almost 1 billion patient records from countries all over the world, and we're now seeing amazing innovations coming out of Africa and India and Asia Pac, US, Europe. It's incredible, and it's really, that's the level of engagement and the level of patient records we need in order to be able to draw the inferences and generate the evidence that really improves patient lives.
We have accomplished a lot as a community, but we're still scratching the surface because there's more questions, more use cases. All of them require more new methodology or different approaches to look into that. There are always questions about new conventions and new technology. There's room for more people. Just come in.
Open science actually requires collaboration, it requires sharing, and it requires an openness to recognize that the work that's going to be done is an evolving process that a community has to be able to do together.